And I think we need to move on to the second panel, which is about the alcohol environment and behaviors. And we will first hear from MJ Paschall. I hope I got your name more or less correct? Senior Research Scientist at the Pacific Institute for Research and Evaluation. And then we'll hear from Thomas Greenfield, the Scientific Director at the Alcohol Research Group. And he will be coming over to the ether as well. And finally, we'll hear from Deborah Furr Holden, the C.S. Mott Endowed Professor of Public Health at Michigan State University. And as in the last panel, we'll wait till all three speakers have had a chance to give their presentations and then follow up with Q&A. So, MJ?
They're coming. There you go.
There you go.
Great.
You're on.
Thank you. Thank you for inviting me to hopefully contribute to this worthwhile endeavor. I thought it might be useful to share with the committee some experiences and findings from several community trials I've been involved in over the past 15 years, all of which focused on environmental prevention strategies to reduce hazardous drinking and impaired driving among adolescents and young adults. The studies I'm going to talk about are the Safer California University's Alcohol Risk Management and Oregon Reducing Youth Access to Alcohol trials, both of which were funded by NIAAA, and the California Strategic Prevention Framework State Incentive Grant, or SPIF-SIG, which was funded by SAMHSA and NIAAA. Common goals of these studies were to identify effective multi-component interventions to reduce the retail and social availability of alcohol to underage youth and to reduce hazardous drinking and driving among young people. In all of these studies, we were evaluating a multi-component environmental intervention which included some or all of these components. Minor decoy and reward and reminder operations to reduce retail alcohol availability, party patrols and the use of social host or response cost recovery ordinances to reduce social availability, minor in possession enforcement, RBS training and enforcement, DUI checkpoints and saturation patrols, and use of various types of media to increase public awareness of alcohol problems, alcohol policies, and enforcement activities. Common research questions across these studies were, how do we get communities to implement or increase implementation of evidence-based environmental interventions? That was a big one. Do multi-component interventions have an effect on underage drinking, hazardous drinking, and drinking and driving at the community level? And how does the community alcohol environment influence intervention implementation and effectiveness? All of the studies required buy-in and cooperation among key players in each intervention community, including alcohol prevention coordinators, city government officials, city and campus police, and community-based organizations. There definitely were some challenges in getting these different agencies or organizations to work together, and I think this was especially true in the California SPIF-SIG study, where the county prevention coordinators and community-based organizations had never really worked closely with police departments. So time was needed to build trust and understanding of how the different agencies or organizations would have complementary roles in implementing the intervention components. Another common feature of these studies was sharing data with the community groups to help them see where alcohol problems were occurring and to help them focus on settings or places and times as targets of interventions. This chart is from a survey of students at one California university showing that the majority of alcohol problems occur at or in relation to off-campus parties. We created charts for different types of alcohol problems related to different settings, and this one shows how the majority of drink driving episodes were also occurring in relation to off-campus parties. So these are social gatherings in private settings. We used this chart from a statewide survey of Oregon 11th graders to show how the majority of adolescents get alcohol from social sources and at parties in private settings rather than from commercial sources. And we used this chart to show how the majority of 11th graders thought alcohol would be easy or very easy to get. And just to say that I think we know a lot about how to reduce the retail availability of alcohol to underage kids, but much less about how to reduce the social availability of alcohol. This is a chart we used for the 24-city SPIF-SIG study in California from a baseline survey of young adults, showing that over half of the respondents thought it was unlikely or very unlikely that they would be stopped by the police if they were drinking and driving. So this helped to show the need for greater enforcement of drink driving laws and public awareness of DUI enforcement activities. Rebecca Ramirez would be happy to know that we were also using place of last drink data in intervention cities where these data were being collected to show where DUI offenders were drinking. And you can see in the table on the left, if you can see those numbers, that among younger first-time offenders, 42% reported having their last drink in a private setting, while about 41% reported having their last drink in a bar or restaurant. And the table on the right shows that over 50% of the repeat DUI offenders reported having their last drink in a bar or restaurant. There was also more specific information collected about drinking locations that local police could use to focus their efforts on problem bars or restaurants. This figure was created from a study of 50 California cities by Paul Grunwald, showing the elevated risk of alcohol-impaired motor vehicle crashes in relation to higher bar density in the downtown area of Fresno and in higher population density areas in the city. This pattern, which Paul refers to as the donut hole phenomenon, was observed across the 50 cities and helps to show where RBS and DUI enforcement activities should be happening. In the 24-city SPIF-SIG study, we also used logic models to help community groups visualize how the various intervention components could reduce underage drinking, excessive drinking, and alcohol-related motor vehicle crashes, and to help them plan specific intervention activities. You can see the intervention strategies intended to reduce retail and social alcohol availability in the light green boxes at the bottom, and the targeted outcomes in the pink boxes. And here's an analogous logic model for alcohol-related motor vehicle crashes. I'll just say that some people love the logic models, while others found them very challenging. Here's a sample work plan from one of the SPIF-SIG intervention cities. We were asked by the community groups to provide specific information on how many enforcement operations and related visibility activities would be needed each year. So we recommended 2 types of enforcement operations and related visibility activities per quarter. So that was the goal, which was accomplished to varying degrees across the 12 intervention cities during the 3-year intervention period. Based on monthly activity logs, we created charts showing the frequency of DUI enforcement operations per quarter. The orange line represents saturation patrols, and the blue line represents DUI checkpoints. So you can see a fairly steady increase in saturation patrols, but somewhat of a decline in the DUI checkpoints over the intervention period. That probably reflects the reluctance of local police departments to do more DUI checkpoints because of the time and number of officers that would be needed. And we suspect that many of the saturation patrols may have been routine patrolling activities by officers in bar districts, and we would have liked to see a lot more DUI checkpoints. And just a little anecdote, one of the intervention cities had a university nearby, and there is a bus service that someone started specifically for transporting students to and from the bar district, especially on weekends. So I asked the deputy police chief in that city whether he thought the bus service was helpful in reducing drinking and driving incidents. And he said yes, it probably is, but it's a bad idea because we have so many more problems with drunk students in bars than we used to have. So he was against the bus service for that reason, and there was clearly a trade-off for safe transportation. This chart shows the frequency of operations targeting server behavior. The yellow line represents RBS enforcement operations, which were supposed to be undercover operations, but we know that bar walkthroughs were included in the monthly reports at as RBS enforcement operations, and local police departments were reluctant to do undercover operations due to the amount of time required and the low probability of making an arrest. We encourage the police departments to do brief undercover operations and let the bar owners know that they were there, and not to be so concerned about observing overservice and issuing citations or making arrests. So we did have some success in getting some of the local police departments to do undercover operations, but not nearly as many as we would have liked to see. Another little anecdote, a nightlife officer in one of the intervention cities was sort of bragging to us about how successful he had been in getting to know bouncers working at the local bars and clubs, and how he was often responding to calls from bars with customers who had too much to drink and were causing trouble or needed assistance. So we asked him if he ever thought about why he was getting so many calls from the bouncers or the local bar owners. And he gave us kind of a perplexed look. And he said, well, it's obviously because these young people just don't know how to handle their alcohol and drink responsibly. So then we explained that it might also have something to do with over-service to customers who've already had too much to drink. And he and the police department were basically providing a service to bars at the taxpayer's expense. Thank you. So that be friendly with bars mentality was pretty common across the intervention cities. This chart shows the frequency of enforcement visibility activities, and again, the orange line represents visibility activities related to saturation patrols, and the blue line represents visibility activities related to DUI checkpoints. There were far fewer visibility activities related to RBS enforcement and party patrols. The types of visibility that were used in the intervention cities included public service announcements on radio stations, posters, signs on buses, letters to businesses about enforcement operations, marquees at schools about DUI enforcement, bar visits by officers, press releases, and use of social media. And just to show a couple of examples, some of the intervention cities adopted or adapted this poster that was developed by the Ad Council and NHTSA for the National Social Norming Campaign. It was put up near bars and other areas, including high schools, to increase awareness of DUI enforcement among bar patrons and underage youth. This slide shows a letter from the city police chief to license on-premise retailers about minor decoy and undercover operations that would be happening. The letter was hand-delivered to problem bars that were identified with place of last drink data. And you also see a couple of cards for bartenders and servers that were distributed to on-premise establishments. These were also displayed in larger scale on city buses. We do have some preliminary findings from the 24-city SPIF-SIG study indicating a decrease in the rate of DUI injury crashes in intervention cities during the first 2 intervention years. However, this effect didn't persist in 2015. Of course, this only represents a fraction of alcohol DUI crashes, and we aren't seeing significant differences in the overall rates of DUI crashes, including the ratio of alcohol to non-alcohol involved crashes. We're still working with Switter's data to look at how these motor vehicle crash rates compared for younger drivers, and we'll also be looking more closely at how crash rates may vary by intervention intensity, since we know that there was variability in the frequency of enforcement operations and visibility activities across the intervention cities. We're also not seeing any intervention effect on the perceived likelihood of being stopped by police for drinking and driving in the young adult surveys. Going back to the Safer California University study, there were significant, though modest, intervention effects on the likelihood of intoxication, particularly at off-campus parties and bars where the interventions were focused. This graph shows that although there was essentially no change in the prevalence of intoxication at off-campus parties among students at intervention schools, there was a 12% relative increase at control schools. We also saw greater intervention effects on the likelihood of intoxication at schools with higher intervention intensity levels based on the frequency of enforcement operations and visibility. This graph shows a greater reduction in the likelihood of intoxication at any setting at intervention sites with the highest level of enforcement and visibility compared to other sites. Similarly, there were significant reductions in the likelihood of drinking and driving or riding with a drinking driver among students at intervention schools compared to students at control schools, particularly in relation to off-campus parties and bars. This graph also shows a stronger intervention effect on drinking and driving at sites with higher intervention intensity levels. In the Oregon RYAA study, there were significant intervention effects on the likelihood of alcohol sales to minors based on purchase surveys we did in intervention and control communities. This graph shows a greater reduction in the alcohol sales rate for intervention communities relative to control communities, though clearly there was a downward trend in sales for all communities in the study. We think this may have been due to more compliance checks being conducted by the Oregon Liquor License Control Agency. And again, it looks like we know how to reduce the retail availability of alcohol to underage youth, but social availability is still a big challenge. Although we didn't see any significant intervention effects on alcohol use or binge drinking based on intent to treat analyses, we did see reductions in both past 30-day alcohol use and binge drinking in communities with higher intervention intensity levels, as measured by the number of warnings or citations issued by local police officers for minor in possession and other alcohol policy violations. We also observed this intervention intensity effect based on person hours devoted by police officers to underage drinking enforcement activities. So to summarize, common challenges we encountered in these studies were establishing positive working relationships among key players in the intervention communities. We often heard police officers saying that their departments were understaffed and limited in what they could do, the types of enforcement operations we wanted to see more of, like undercover operations, party patrols, and DUI checkpoints, were the least likely to be implemented on a regular basis by local police departments. This may have to do with the belief that enforcement operations like party patrols and undercover operations weren't as important as enforcement activities related to other crimes, or just weren't worth the effort. And media messages were sometimes focused more on health and safety than enforcement, and they weren't as coordinated with enforcement operations or targeted to specific audiences as they could have been. So in general, effects of these multi-component interventions were modest, which could be attributable to the level of intervention intensity or other influences of the community alcohol environment. Other research I've been doing indicates or suggests that local alcohol control policies like social host laws and indicators of retail and social alcohol availability like outlet density and adult drinking can influence normative beliefs and alcohol use among underage youth and young adults. This graph is from our study of 50 California cities with a prospective cohort of 1,500 adolescents. It shows that the highest rate of increase in heavy drinking over a 3-year period occurred in cities with the least comprehensive and stringent alcohol control policies, while the lowest rate of increase occurred in cities with the most comprehensive and stringent alcohol control policies. We saw a similar influence of adult drinking and alcohol outlet density on adolescent drinking across the 50 cities. So in conclusion, we're still looking for viable strategies to increase enforcement related to overservice of alcohol, underage and hazardous drinking in private settings, and DUI checkpoints, as well as visibility of enforcement activities. And I think that translational research can play an important role in identifying strategies that are most likely to increase the implementation of these types of environmental interventions. Thank you.
Great, thank you.